Hi everybody, Mary O'Keefe here from the European Pain Federation EFIC. Today I'm joined by Reto Huber to give you a teaser of his talk at the 2022 EFIC Congress. Reto, thanks for agreeing to be interviewed. It's great to have you. Do you want to start us off by introducing yourself, please?
Yeah, thanks for inviting me. I'm really glad to be here and already give this teaser and talk about what I'm going to present. So I'm professor at the Children's Hospital and the Child and Adolescent Psychiatry of the University of Zurich in Switzerland. I'm a neurobiologist by training, and I focus on basic but also applied sleep research.
Great. And what will you be talking about at EFIC 2022?
So generally what we have learned over the last years, or decades, is that sleep is really important to maintain network activity of our brain. And so that's why it is so important for also cognition and mental health. And so I will talk about how sleep, what we know about sleep, how it contributes to maintaining this balance, and what we know about the mechanisms behind that. And in essence, what I will talk about is that sleep is to some extent the price we pay for learning during the day. And I will show in my presentation what we know about this topic.
Okay, great. And in the media and in surveys that we see every day, it's often said that most of us aren't getting enough sleep, or that we have a sleep epidemic on our hands. Would you say this is accurate?
I would say this is accurate to a large extent, primarily because we see that, especially during the work days, I would say, because what we see in most of the studies across the world is that during the weekends, children, adolescents, and adults sleep more than during the workday. So they somehow need to have catch-up sleep. And that's a kind of the evidence we have that likely we do not sleep enough during at least the work or school days.
Okay. And what would you say is sleeping enough?
Of course, sleeping enough is a very difficult term because it's individually so different. We know that among us, there are really short sleepers who get along with 4 hours of sleep per night very, very well. Then there are also on the other side, long sleepers who need 10 hours of sleep that they are fully recovered. Of course, the majority of us is somewhere in between 7 and 8 hours typically, and so individually it varies a lot, and there's no answer for everybody. So everybody has his own sleep duration or preferred best sleep duration.
Okay. Yeah, I think some people would be surprised to hear you say that, because the guidelines often say, you have to be getting 7 to 9, and if you don't, you're going to experience some adverse effects in the future. So can we say for sure that the people that are having, let's say, 4 to 6 hours sleep, that in the future, do we know that some people can get by and thrive on that amount of sleep?
I think the best rule, of estimating this is whether you have daytime sleepiness. If you have a short sleep duration and you at the very same time during your work days encounter excessive daytime sleepiness, it is a clear sign that probably you did not sleep enough. But if you do not have that, if you're really in a balanced state and you're getting your sleep window 4 hours, let's say in the extreme case, and you're absolutely well rested and functional all day, I think there's no scientific evidence we have that this has a negative impact on your life.
Okay. And in terms of daytime sleepiness, how would you go about assessing that? Would it be best to assess it subjectively, just asking the person, or would you get them into a lab and do some objective measurements?
Well, the problem with subjective, it's a good start, the problem to ask subjectively, and in the end, it's again a personal thing, it's basically you see that you have a problem yourself, because you're falling asleep in a presentation, for example, or while listening to a presentation, or various situations, then obviously you might have a problem there, which probably would be ideal to look at more carefully in a lab setting, you know, where this can be assessed. Because one problem there is that subjectively, if you are on the chronic sleep deprived condition, the subjective estimation is actually getting worse. So that's a little bit the downside of this subjective estimation. So I would rather look at signs where you have lapses, or where you really fall asleep or close to be falling asleep, which then you should be very careful about and look into where this comes from.
When you say a person's estimation changes with a subjective assessment, what do you mean by that it gets worse over time?
Well, if you are under this condition that you are not sleeping enough, we have really good evidence which shows that if these people are asked, you know, how well can you perform, or how well did you perform a specific task, that they typically start overestimating their actual performance. So they're not recognizing that actually they have lapses, you know, where they not performing well. You know, this of course is most dramatic when you, for example, driving a car, you know, when you're not having a good estimation of whether you're still fit to drive. And that's the classic, and there's very good evidence that this on the chronic sleep deprivation is that this progressively occurs. So the longer you do not sleep enough, the more likely is that you're underestimating your actual level of performance.
Okay. And does it work the opposite way as well, where people maybe be performing well in terms of sleep, but they're underestimating how well they perform? They think their sleep is worse than it is.
I mean, in pathological condition, yes. I mean, I think insomnia patients is one example where this is the very classic, you know, that they have very much the feeling that they do not sleep well, you know, they definitely underestimate, and often, I mean, of course, this cannot be generalized, but often if then their sleep is assessed in the lab setting and basically discussed with the patient, that they for the first time see actually, well, that they slept maybe 6-7 hours, where they had the feeling, subjective feeling, that they might have slept only a couple of hours. So there can be quite some discrepancy between this. So in this pathological condition definitely exists, yes.
Okay. And I'd mentioned earlier that the media and surveys and the results, we hear about different results of surveys a lot in the media, encouraging people that they need to look after their sleep better. Does this impact on our patients then and the public if they are somebody that might actually be sleeping okay, but maybe they tend to worry a lot? Could that make them more anxious about their sleep, or could there be any relationship there between what people see in the media and how they then perceive their own sleep quality?
Yeah, I think we have one example where we see that this trend to occur. You know, this is related to somewhat this obsession of lots of people, you know, to not only measure how active they are, but also measure their sleep with apps on our mobile phones we all carry around. And there are some reports, significant reports, who actually show that under certain conditions, this can actually lead into a vicious cycle, you know, where you start worrying about not getting enough sleep because your app tells you in the morning that you missed 1 hour of sleep last night. So if you are in this vulnerable situation where maybe sleep is not so easy for you, this can actually spiral, get into this vicious cycle, which is certainly not good. And sort of we all know that probably to some extent, you know, if we are worrying too much about sleep, if we want to sleep, you know, it's not something we, or most of us at least, is not something we willingly can do. You know, we can relax and wait for sleep to come, but we cannot give a command and basically sleep, you know. It's not like eating, you know, which is a different behavior. There we can, of course, prepare food and eat, you know, and satisfy this. But for sleep, it might be a little bit more tricky. There's lots of psychological factors being really important, which are needed for sure for falling asleep, you know.
So based on that, the apps could have a downside and psychological factors are important in sleep. What advice might you give to somebody that wants to improve their sleep?
Yeah, I mean the classical sleep hygiene rules are there, and they are always the first approach, you know, or the first means people would be recommended if you have a bad sleep. And this is, for example, regular bedtimes, so that you're going to bed always at the very same time, you get up at the very same time. You make sure that your bed and your bedroom is quiet, dark, and rather on low temperature. That, for example, also sometimes it's recommended to avoid clocks in the room, so that you're not checking constantly. Oh, it took me now already half an hour passed, 2 hours passed. So only that can help. So everything which allows us to calm down and relax is good. Also activities before sleep, which are of course arousing, should be avoided. And the very important thing, I think, is to have a sort of a bedtime routine, you know, so that we're always going through the same routine, you know, brushing our teeth, changing clothes, maybe reading a book or listening to music, whatever is needed. It's very, very personal. But such a routine in preparing for going to sleep definitely helps than initiating that.
Okay. And if the routine varies, so if you have someone that's a night owl versus a morning lark, where their routine might be they go to bed at 1 a.m. or 2 a.m., is that still considered a helpful routine? Or because they're going to bed later and they're a night owl, are they somehow at greater risk of issues going forward? Or is that normal? Is that a normal variation in sleep?
Yeah, it's very similar to what we discussed before about sleep duration, you know, where there are among us short sleeper and long sleepers. It's very same. There are among us really very late type owls, and there are also early types, you know. It's also a normal distribution of where the preferred sleep time is. So that's biology in us, which we are born with, you know. And so that per se is not a problem. What's well known, however, is that night owls or late types are actually the ones who have more problem with coping our society or systems in place in our society. You know, the classic is school start time goes into this. You know, where this is typically fixed. You know, there's nothing you can choose about. And of course, there the late types have more problem with that. And there are many other of these aspects. So typically, the other night owls have more problems in coping with the time scheduling of our society.
And do you ever see the day that parts of society could be changed or personalized to people that are night owls, particularly children or teenagers? Could you see school times changing to facilitate that, particularly if the research is getting stronger? Or what do you think?
Yeah, absolutely. I mean, this is interesting across the world, you know, that there are certain countries have picked this up quite significantly and made efforts, you know, and to change school start time. Others haven't. I mean, Switzerland, for example, where I'm from, they haven't done that so far, even though we have quite early school start times. Others, like in the United States, there certain states already have implemented that And like in Great Britain, for example, school start time traditionally is rather later. So that varies a lot across the countries, but certainly is a topic and has been looked at carefully, which I think makes really a lot of sense given the scientific evidence we have that this is beneficial for school performance and so on.
Yes, yeah, that is interesting to see if other countries will actually change their guidelines on school going. So the next question is to do with pain, because that's the main idea behind this Congress. So people with chronic pain often report other issues like poor sleep, emotional issues, whether it be anxiety, low mood, depression. Do you know how all of these different things interact? So sleep, pain, emotional regulation. How
Mhm.
why do you think these elements might be interacting with each other?
Yeah, I mean, part of this we already have covered in what we talked about before, but because the very obvious is that having pain, of course, is one factor which, of course, has a bad influence on sleep. You know, falling asleep under pain obviously is difficult because it's against what these sleep hygiene rules would tell you, know, that you should be relaxed and so on, you know, and typically pain would rather likely do the opposite, you know. So this relationship between pain and bad sleep and then maybe not getting enough sleep is quite obvious in my opinion. Um, and then the next step is again, well, that of course, as said before, sleep is really important for emotion regulation and all these processes in maintaining, you know, our balance of network activity. You know, of course, then if you have over a prolonged time not enough sleep, of course, it limits the ability of sleep to maintain that balance, and that leads then into again this vicious cycle that then it rather results into bad mood, depression, and so on, which then leads into even more problems, you know, be this related to pain, but then also related to sleep again.
Yeah. Many of the psychological treatments we have try to tackle this vicious cycle between sleep, pain, and mood. And often it's to focus on relearning some behavior. So relearning how we think about pain, how we think about sleep, how we respond to pain, whether it be instead of avoidance, you know, actually doing some physical activity, doing something you're anxious about. How does sleep belong there? Because we're trying to get people to relearn and maybe change even their memories around certain even painful experiences. How does sleep promote learning in this situation?
Yeah, that's certainly going to be one of the key topics of my talk. You know, how learning and sleep and memory are related, because that I think it has been a really strong topic over the last decades in sleep research, because we have really good evidence that actually during sleep, some of these consolidation processes, you know, stabilizing such memories take place, and we also know that sleep is really important, that the capacity to learn is maintained, you know, so that if you're not getting enough sleep, this capacity to learn new information is very much impaired. So we have many really good evidences showing that sleep and learning are very tightly related, and that enough sleep is really needed for these processes to be maintained and continued over time. So in that respect, I think there are even studies now starting, you know, where this is used in therapy, you know, built in, that some of these paradigms take the sleep part into account, you know, to, for example, there are studies where some of this learning material is, for example, presented during sleep, you know, to the sleeping participants, And some of these studies actually show that this can have benefits, in these learning processes. So we start to understand a little bit these processes and how we can influence and take advantage of them, and maybe get some benefit in the long term for exactly what you just said, for the patients.
And is there any short-term way of inducing sleep for therapy? So if I'm a physiotherapist and I want to work with a patient on exposing them to a movement or an activity that they're really afraid of, but they happen to be highly anxious and also sleep deprived, is there anything in the short term that you can do to maybe improve their sleep so that the physio can engage with the activity or exposing them to something different? Or do you have to get them into a lab for that?
Yeah, I mean, it's of course matters a lot where the sleep problem comes from. If there is a physiological underlying, then obviously a sleep lab would be best, to at least look at that. If, let's say, it's more a psychological side, then of course these sleep hygiene things, rules I explained before might be important, but that might not help you in the short term. That's what you're talking about. That's the real challenge. How can we get somebody the next night, when you send them home, into good sleep? And that is not so easy. And there, of course, sleep medication is a means to go. I think it is. It can be helpful, especially for short-term use, to exactly achieve this, because there are really good medications out there who are very efficient, who will bring you into sleep very, very likely. And so maybe on the short term, this might be something desirable or meaningful for exactly this situation you mentioned. One other way, but this is again taking a little bit more time, is of course to see that people are not sleeping too much, and also to limit their sleep the night before to the absolute minimum, or even a little bit less, will increase the likelihood that the following night you're really tired when going to bed and fall asleep. So that's, without medication, something which can be played with and is actually also done, in some of the therapies, is actually rather counterintuitive to restrict their sleep, shorten sleep. That results in an increase in this pressure to go to sleep, and might help some people to really then fall easier into sleep or maintaining sleep.
So that would look like deliberate sleep deprivation for a night.
Exactly. Of course, I would only recommend that if there's no evidence that these people are already chronically sleep deprived, then it's obviously not the ideal thing. But if somebody is rested and has not daytime sleepiness and signs like that, then maybe this would be something at least to try.
Okay. And in your view, what are the most exciting developments in sleep science that could have a health impact? So improve general health, but also even in terms of tackling pain.
So I think one of the most exciting new avenues is definitely this glymphatic system, which has been discovered, which is really very relevant during sleep. I think this is covered at this conference as well. So I think that's really an exciting avenue, especially going in the direction of neurodegeneration and all these processes. There is very good evidence that there is something really specific to sleep. So that's certainly something exciting. I think another exciting avenue is that over the last years, more and more techniques have become available, which allow us to modulate sleep, or at least specific aspects of sleep, which is even more interesting, but it's not just sleep in general, but very specific aspects of sleep, which would allow us really to to target also specific deficits we see in certain patient populations during sleep. So I think these are more technological developments. They're not yet there to be applied in a clinical routine, but there are some exciting results coming out now showing that there is some potential for this, I would call them more neuromodulation approaches to also be used in sleep research.
Excellent. And the dreaded question, so, is why do we sleep? A lot of sleep scientists are asked that question. Based on your research to date, how close are we to knowing why do we sleep? Even in terms of health, do we actually know, or how close are we to knowing?
Yeah, I mean, it is still considered one of the big unanswered questions in neuroscience, and I would still stick with that general notion. Of course, we have gained some puzzle pieces over the years, which are quite significant. One of them might be this lymphatic system and how it's related to sleep. I think also all this knowledge we gained about how sleep and learning and memory are related is also a piece into this. Maybe there are also more from the periphery, how sleep is related to metabolism or the immune system. So I think we can go through many different systems where we have learned quite a lot how sleep contributes to maintaining or supporting these systems. And I think this is very health relevant for many different conditions. And so maybe there's not a single answer of why we sleep. I mean, that's my more personal approach to this, but maybe a lot of different aspects which are ideally situated in sleep, or functions which take place ideally during sleep, who are quite relevant for our health.
Great. So finally, why should people attend your talk, do you think?
Well, exactly, to learn about this, what is the current knowledge? At least I will focus more on brain health. So it's a brain-centered view of how sleep contributes to for having for being able to maintain cognitive performance and mental health. I think that's what I will highlight in my presentation at the conference.
Super. Thanks, Reto. I'm looking forward to seeing you at the Congress. So for those listening, if you want to join us at the next EFIC Congress in Dublin, Ireland in April 2022, the good news is tickets are now available, and you can just visit the www.efic-congress.org website to get the tickets. Thank you and bye.
Thank you. Bye.